Hello, everyone. Welcome to my channel. I'm Sophia, and today we're going to talk about a very important topic, premature birth. As expectant mothers, the risk of premature birth is one of our biggest concerns. Understanding the signs of premature birth and taking preventive measures are key to ensuring the health of both mother and baby. In today's video, I will guide you through how to prevent premature birth and what warning signs you need to pay special attention to. If you or your friends are currently pregnant, make sure to listen closely, as this information may be valuable to you. First, let's understand what premature birth is. Premature birth refers to the delivery of a baby before the 37th week of pregnancy. Generally, a full-term pregnancy lasts from 37 weeks to 42 weeks, and the earlier premature birth occurs, the greater the health risks for the baby. Premature infants usually require special care as their organ systems, especially their lungs, have not yet fully developed. There are many risk factors for premature birth, including the mother's age, health conditions, and pregnancy circumstances. We should try to avoid these high-risk factors to reduce the likelihood of premature birth. There are several common causes of premature birth. Understanding these potential triggers can help us better prevent it. Here are some common causes of premature birth. 1. Multiple pregnancies. Pregnant women carrying twins or multiples are at a higher risk of premature birth due to increased pressure on the uterus. 2. Uterine or cervical abnormalities. Abnormalities in the uterus or cervical insufficiency may lead to premature birth. 3. Pregnancy complications. Issues like gestational hypertension or diabetes can also trigger premature birth. 4. Infections. Certain infections during pregnancy, such as urinary tract infections or intrauterine infections, may stimulate uterine contractions, leading to premature birth. 5. Lifestyle factors. Unhealthy lifestyles such as smoking, excessive drinking, and drug abuse increase the risk of premature birth. Next, let's focus on how to recognize the signs of premature birth. Understanding these signals can help us detect problems early and take timely action. Here are some common signs of premature birth. 1. Frequent contractions. If you feel more than 4 to 5 contractions per hour during the second or third trimester, especially accompanied by abdominal tightness, this may be a sign of premature birth. Contractions can lead to thinning or dilation of the cervix, resulting in premature birth. 2. Persistent back pain. Unlike regular pregnancy back pain caused by premature birth is typically continuous and more intense. 3. Increased pelvic pressure. If you suddenly feel a sense of heaviness or increased pressure in the pelvic area, this may be a sign that premature birth is imminent. 4. Vaginal bleeding or abnormal discharge. Any blood-tinged discharge or rupture of membranes is a warning sign of premature birth and requires immediate medical attention. 5. Diarrhea or gastrointestinal discomfort. Some pregnant women may suddenly experience diarrhea or gastrointestinal discomfort prior to premature birth. If you experience any of the symptoms mentioned above, make sure to contact your doctor promptly. Early intervention can prevent the situation from worsening. So, how can we prevent premature birth? While some causes of premature birth are beyond our control, such as multiple pregnancies or uterine abnormalities, we can effectively reduce the risk of premature birth through a healthy lifestyle and proper prenatal management. Next, I will share some important measures to prevent premature birth. 1. Regular prenatal checkups. Regular prenatal examinations are fundamental for preventing premature birth. Doctors can monitor your physical condition and the baby's development through these checkups, allowing for early detection of potential risks for premature birth. To control chronic diseases, if you have chronic conditions like diabetes or hypertension, it is crucial to manage them strictly during pregnancy. Proper control of blood sugar and blood pressure helps reduce the risk of premature birth. 3. Control chronic diseases. If you have chronic conditions like diabetes or hypertension, it is crucial to manage them strictly during pregnancy. Proper control of blood sugar and blood pressure helps reduce the risk of premature birth. 4. Control chronic diseases. If you have chronic conditions like diabetes or hypertension, it is crucial to manage them strictly during pregnancy. Proper control of blood sugar and blood pressure helps reduce the risk of premature birth. 5. Avoiding tobacco and alcohol. Smoking, drinking, and drug abuse increase the risk of preterm birth, so these unhealthy behaviors must be avoided. 6. Preventing and treating infections. Infections during pregnancy can be a hidden cause of preterm birth. Therefore, regular checkups, maintaining good personal hygiene, and treating infections early are essential. 7. Managing stress. While some stress is inevitable during pregnancy, excessive stress can affect health and even trigger preterm birth. Using relaxation techniques such as meditation, yoga, and deep breathing can help alleviate stress during pregnancy. 8. Nutritional supplementation. Maintaining a balanced diet and supplementing essential vitamins and minerals, especially folic acid, iron, and calcium, can promote healthy fetal development and reduce the risk of preterm birth. What to do if preterm birth is inevitable? Even with various preventive measures, some preterm births may be unavoidable. If your doctor has determined that you are at risk for preterm birth, the following strategies can help you extend the gestational age as much as possible or prepare for premature delivery. 1. Bed rest. Your doctor may advise you to rest in bed to reduce uterine pressure and delay preterm labor. 2. Medication intervention. Your doctor may use medications to suppress contractions or provide steroids to help the baby's lungs develop, thereby reducing the risks associated with preterm birth. 3. Monitoring fetal development. Once the risk of preterm birth increases, doctors usually monitor fetal development more frequently to ensure that every day in the womb is safe for the baby. If the baby is born prematurely, the hospital will usually take special care measures, such as placing the preterm infant in an incubator to regulate temperature and prevent infections. Additionally, preterm infants require closer health monitoring to ensure stability in all vital signs. As parents, you also need to learn how to care for preterm infants at home, such as ensuring adequate nutrition intake, closely monitoring the baby's weight and growth, and regularly taking the baby for health checkups. Today, we've learned about the causes, signs, preventive methods, and coping strategies for preterm birth. While preterm birth is a challenge we would rather not face, being vigilant, maintaining a healthy lifestyle, and communicating actively with doctors can significantly reduce the risks. I hope today's video helps all expectant mothers understand preterm birth better and take the right preventive measures during pregnancy. If you liked this content, please remember to like, share, and subscribe to my channel. See you next time.